everybody. I'm excited for our guest speaker that we have on today. This is Dr. Peter Steinberg. We are here, he's a urologist, and we are here we're going to do 2 episodes while you're here with me today. The first one today that we're going to talk about is circumcision, and then stay tuned for the next one that's going to be on vasectomies. But Thank you for being here with us today.
Thanks for having me here at NAP's headquarters.
Yeah. We first got connected through just providing services to you and your wife because you have a 6-month-old son.
Yes.
Yeah.
And you got him to sleep through the night. So Thank you.
You're welcome. I mean, this is the shit that I love to hear. So glad that I with your family. Obviously, your expertise coming from the urology world. And we thought it'd be really fun to sort of talk about these 2 topics in a way that was just like a real conversation about decisions that people are making related to penises, and like how to go about making those decisions, and also from your expertise, what things you would think about in the decision-making process, maybe even talking through like these procedures, risks to not doing these procedures, risks to doing them. So that's sort of why we have you here. So
okay,
I'm psyched.
I can talk about all that.
Dive in.
Let's dive.
Rapid fire.
Sure.
All right, so we're gonna start with circumcisions. I feel like the number one question, and you tell me if this is the question that you get in your world too, is around like there's this stigma around like uncircumcised penises being like dirty, or that circumcised penises are more clean. Is there any data, research, merit to uphold this argument?
There is some. The evidence base is not super strong. However, there's evidence that if you're uncircumcised, you have a higher rate of penile skin infections, probably about 10% higher rate than someone who's circumcised. So that's fairly well established. And I think anecdotally, most urologists can tell you that as well. We don't see a lot of circumcised men with skin infections. And there's also some data, mainly from Europe, to suggest there can be some cleanliness issues with boys, especially who are uncircumcised, although that's not as well established.
Okay. So knowing that there are like some risks to not being circumcised, obviously you have to weigh that against like the actual like risks of getting circumcised, right? So what would you say are the biggest risks of circumcision?
So it really depends if you're talking about newborns. Yeah, that's a huge factor. So there's no easier time to get circumcised than as a newborn. So anytime beyond the immediate newborn period, you're basically talking about a procedure under general anesthesia. In compliant adults, these can be done in the office with local anesthesia, although you have to be pretty compliant, and probably not a college age kid. So we're talking like adult. So the primary issues and risks of having a circumcision relate to, probably the number one thing is bleeding. Well, let me just back up. So in newborns, all of the risks are extremely rare for serious problems. There's some minor problems, but serious problems in newborns are really, really rare. And that's because there's just not a lot of skin to remove in a newborn. They're healthy and they heal well. As you get older, you're using different techniques to take the foreskin off. Often you have to suture things back together, as opposed to in newborns where they use clamps and devices and basically just cut the foreskin off and it heals on its own. So it's a very different procedure in someone who's older that takes longer and is more complex. So for newborns, the biggest risk is probably bleeding. Serious bleeding that's going to land you in the ER or need suturing or a transfusion or whatever. That's rare. That's maybe 1 in 1,000 or 1 in 2,000 kids.
Correct me if I'm wrong. Isn't that usually related to like some underlying like medical condition?
It can be. Like a bleeding disorder.
That you don't know about.
Could be, but often there's an artery that runs under the underside of the penis that can be nicked and need to be arrested with stitches or something. So, but that's pretty unusual. Serious infections, super rare. They happen. They can be horrifying, but rare. And you're talking again 1 in many thousands. And then really serious complications where you're talking about things like cutting the head of the penis off, damaging the urethra, the tube that you pee through. Those are 1 in probably 10,000. And they happen, but they're really, really uncommon, especially in people who are well-trained and experienced.
When we're focusing on the newborn, we can stay here for a second. What do you feel like are the most common questions that you get from parents or that parents are considering when they are making, let's start with like making the decision to circumcise?
Sure. So just full disclosure, I'm an adult urologist and don't do neonatal circumcision.
Yeah.
So I've done a very small number in my life, but I've done a lot of adult circumcisions. So the number one question I get is for people who are expecting, should I get my son circumcised? So I get this question all the time.
Yeah.
Like, this is what people ask me at weddings mainly. So
It's your party trick.
this is, I've answered this a lot. So, so the basic things to weigh are, and again, I'm a little biased because I deal with adults who need
Right.
circumcisions, which is a much bigger deal than newborns. And I'm firmly of the opinion there's no better time to do it than when they're born.
Yep.
Because you accrue all of the benefits of the procedure with the lowest rates of risk.
Yep.
So the lifetime benefits that people can expect are things like a reduced risk of sexually transmitted infections. So it's been proven that HIV, HPV, and HSV, the rates of getting them are lower if you're circumcised.
Okay.
The effect might be kind of modest in the US, but it's been proven in many, many studies. You basically cannot get penile cancer, which is super rare, but nonetheless can be life-threatening if you're circumcised. And probably the biggest thing is you're really at a much lower risk of getting urinary tract infections, both in the neonatal period, the childhood period, but also as an adult. And that can be a problem. It can land you in the hospital. And you're also at a lower rate of getting foreskin infections, so things called balanitis. And there's some other infections of the head of the penis. Those are really pretty uncommon if you're circumcised.
Okay.
The other thing is, if you end up with problems later in life and need a circumcision, it is a much bigger deal, and people have more problems and more morbidity, both beforehand in terms of problems with their foreskin, either pain, cracking, sexual problems, can't get it clean, whatever, and then the recovery from the surgery. So all those benefits are things that people accrue early on. You know, there's some discussion about things like cosmesis, or you look like the other kids in the locker room. That's sort of a separate thing, if you ask me. But those are the main benefits, and you get that accruing over your whole life if you do it as a newborn.
And do you find that most people are making this decision based on their own like personal preferences and or background? So like if you have a dad who's circumcised and then you have and they have a son, that son's going to be circumcised?
Well, so
and or religious background.
Yeah, I mean, the number one thing, and this is surveys and anecdotally been my experience, is that people sort of socioeconomic cultural background. So I'm Jewish, for instance, so, you know, or people who are Muslim or whatnot, or if that's often the first layer, or what's everybody else doing where I live? You know, are you on a hippie commune and nobody's doing it? So that's kind of number one. That's probably half to 2/3 of people make the decision based on that. And then the next one is sort of what's the deal with dad? So often if you don't have strong feelings, which a lot of people don't, often the default is, well, what's dad doing? So there's not a lot of discordance between the foreskin between father and son, to be honest. So usually those things kind of line up.
Okay. And so it seems like when you're making this decision as, you know, an expecting parent who knows that you're having a son, or you know, you have your son and it's a surprise and you're trying to make this decision in the hospital, or maybe you talked about it even ahead of that. It really is like the risk and you know, weighed against the benefits of doing it now versus like not doing it, and potentially the risk related more to if your son decides later in life that they want to be circumcised.
Correct.
Okay.
Yeah, the big detractors against circumcising newborns, the biggest argument you get is it's effectively elective.
Right.
A lot of people make evolutionary claims, like, why does the foreskin exist if, you know, there must be some reason. It's not exactly clear what it is, but nonetheless. And then there's obviously the risks, but the biggest thing people, I think, tend to hang their hat on is some type of sexual dysfunction later in life. That seems to be the thing where people are like, you're cutting out all this stuff, you're screwing up my kid's future sex life, blah, blah, blah. The evidence for that is very, very weak.
Okay.
So the best evidence that's out there about that argument comes from the HIV prevention circumcision trials done about 15 years ago in sub-Saharan Africa, in Kenya and Uganda. They were trying to prevent HIV by circumcising adult men. It's very effective at preventing heterosexual HIV transmission, but they did sex satisfaction surveys in all those men. Some men do have decreased sensation. However, pleasure with sex, there's no change. And other things like erectile dysfunction, premature ejaculation, things like that, there really is no difference. So some men say there's less sensation, but they still find sex as pleasurable. So for what that's worth.
Right.
Other things, it's easier to put a condom on if you're circumcised, they found from that trial. So I don't know that many parents are thinking about that, but, and in general, female partners at least often tended to have a cosmetic preference for circumcised penises, at least in those trials.
Gotcha.
There's been other stuff that's been done of various degrees of robustness or reproducibility where they put like electrodes on foreskins versus other parts of penises and tried to say their differences, but that's like a dozen people in one sex lab once. So it's pretty hard. Yeah, I rely on these big trials of thousands of men in Africa, and they said there was no difference in sexual satisfaction.
Okay.
I take that as pretty good.
Yeah.
And these were people who had sex uncircumcised and circumcised and could draw their own internal conclusion, as opposed to two totally separate groups of people. So I think that's pretty weighty.
Yeah. What about this concern over obviously getting your kid circumcised, feeling like maybe it is, an elective and or cosmetic procedure, and it causing pain? So again, talking about the newborn, what is your explanation for, or how do you talk to parents about the pain of it?
Yeah. So, I mean, it used to be back in the not that long ago day, these were not typically done with any type of anesthesia in the newborn period. So I think that's changed a lot in the last probably 20 years, I would say. I've definitely been involved socially in people who've had like a moil who was experienced, do circumcisions where they may not use local anesthetic. I can say in particular, my two nephews, that's what happened with them. They seemed okay pretty quickly after. I will say that my personal opinion is you should have this done by someone in a medical setting. Even a well-trained moil is fine. However,
jump to my next question here, Peter.
However, I would say most people doing this in a medical setting are going to use some type of anesthesia. And so most people will use like a cream and just cover it up with some plastic adhesive, like they have these little upside down ice cream cone things to kind of keep that on there. It takes a while for that to kick in. Some people actually do using a needle of penile block or a combo, and they give them a little sugar thing to eat. And that should basically make it pain-free. So I would highly endorse having that approach done as opposed to just snip, if you can have any say in it.
So that's, I feel like that is my next question, since you sort of touched on having it done like in a medical setting.
And that could be a doctor's office, by the way. This does not need to be,
necessarily like in the hospital.
I'm just saying, you want someone experienced, but has just got all the stuff to make it as comfortable as possible.
So then my question is around experience, right? So my experience in the hospital, now I have girls, but my experience working in the hospital was that the person who was on that day, who is trained in circumcisions, would be the one to come in and do the circumcision for your child if you so choose. And is there any questions that you would ask that person? Is there what sort of like, advocacy do you have for yourself or your child if you felt like you wanted somebody else to do it, or you knew of somebody in that hospital setting or the office or wherever you choose to go? I think most people do though have it in the hospital right after delivery. Are there questions that you would ask and or any tips that you would give to somebody if maybe they wanted somebody else to do it?
Yeah. So, I mean, obviously I have one child, and this is something I thought about, before I had the kid. Plus I'm a urologist, plus I have partners whose kids have been circumcised, plus I know people who do this for a living. So I'm in a little bit of a unique situation where I could kind of shop for my snipper. And
who you want it.
I did. And I actually had one of the gynecologists at work who had done a couple of my partner's kids do mine. My son's circumcision. So, and one of our residents is going to Children's to be a pediatric urology fellow next year. He had the nurse practitioner do his son. So from Children's, who does all, a bunch of them there. So, we all kind of like pick our person out in the urology field. So that being said, there are people who do that out there, but their bandwidth is somewhat limited. So if everyone listening to this is like, I want to go to who, I'm not going to name names. Right. They cannot circumcise every child born in Boston. There are too many, kids. And
there are plenty of really
and there are, yes. And
like,
so
even thinking about the hospital, like there are a handful of people who I'm like, 100%, I would let this person.
And the reality is, when it comes to doing any type of procedure, you don't keep getting to do it if your outcomes are not usually good, unless you're in the middle of nowhere. So the people who are doing these things are probably fine. So here are the big things you want to know. Are they going to use any type of local anesthesia plan? Some general sense as to experience. A lot of people can't tell you exactly how many they've done. However, if you're dealing with someone who does several a week or many a month, you're probably good.
Yeah.
So, someone who does 6 a year, you probably want a little higher volume than that. But you want someone who's done like hundreds, not thousands, not a million, but someone who's doing many a month, you're going to be fine with some experience. You probably don't want the person who's, it's week 1 in, the NICU or whatever. And then the other thing I always ask is what clamp is going to be used. So there are different clamps to do this. There are pros and cons to the different devices. There's a thing called a Gomco clamp, which has for lack of a better explanation, it's got a little metal thing that goes over the head of the penis, and then the rest of it clamps around it. And if it's used correctly, you cannot cut the head of the penis off. It takes longer to do. There's a thing called the Mogan clamp, which is what they use in Israel, and it's what most moils and most people that I know do them with this. It looks like a big cigar cutter. Way faster. There is a risk of amputating the head of the penis if you don't use it correctly. So you got to really make sure the head of the penis is below the clamp. So I just ask them and just get a general sense as to why they choose that clamp and what their comfort is. But that, again, it's a little bit of an inside baseball thing. There's one other gizmo that is out there that I think has fallen out of favor. It was called a Plastibell. Which was a little plastic device that's put sort of between the foreskin and the head of the penis and tied down with a stitch, and then the foreskin falls off later. So it's not actually cut off. I think that's generally frowned on for a lot of different reasons. And I would not advise having a Plastibell circumcision.
And when you're asking about these other two, the first 2 clamps that you started with, is it really just asking about what they're using in their experience with it, or a preference of one over the other?
I have no preference as somebody who's not done a ton of these, but I'm doing this as a surgeon to kind of gauge this person's experience and ability to describe what he or she is doing. So if they're just like, I don't know what these 2 things do. You want to find someone who knows the difference and can express why this is the technique I utilize. And it's just showing expertise and facility with the procedure, if you ask me.
And it feels like if you're in the hospital and maybe feel like the person who's coming in to do the circumcision isn't the right person for you, other options would be to actually just like look into and research other people in the community where you live who can do this, who maybe more experienced. And there's not, when you're talking about the newborn phase, like what is sort of the window that we're looking at here where it would be not too late, but you know what I mean? Like, we're talking days, we're talking weeks, we're talking months, like what ideal time?
It's a little bit of a sliding scale. The issue is as kids get older, we're talking like months, they need to really be anesthetized to potentially do these things because you can't hold them still enough. For a kid who is a few weeks old, it's not a problem. So I would say you're looking at the first couple weeks of life. I honestly can't speak to the practice patterns of people if you're dealing with a 1-month-old, but if you've got a 10-day-old kid, it's not a problem. I mean,
you decided the person in the hospital wasn't right for you, you can easily find somebody else, get a referral and go to that person.
And keep in mind, like this is what pediatric urologists deal with. They don't they don't do most of the neonatal circs out there, but they do them. And they know, kids are born and you got to get it done. And, I think Boston Children's or MGH can figure it out. So they're aware there's a little bit of hustle there that needs to happen. And, a ritualistic circumcision is usually done on day 8 of life. So, so you're talking sometime in that first couple of weeks.
That alone is just the time frame right there.
And if you're not comfortable with people in the hospital, they don't care. I mean, they just want to know, do they have to do it? If you're like, I'm going to leave my kid uncircumcised, they don't care. They're never going to know. You're never going to see them again. So if you don't like them, just, put the brakes on it. No biggie. They have plenty of other people to see. If you're just like, I'm good, they'll leave. I mean, they are busy.
You're not going to offend anyone.
It's like turning the lactation consultant away. That person is not offended. There is plenty of other work. So on with the day.
And then when we're talking about recovery following a circumcision, what does again focusing on the newborn, what are you typically looking at in terms of recovery? We mentioned earlier that like obviously one of the biggest benefits is the healing process, and I've seen it working as a nurse, like they heal really fast. So what are we talking about in terms of recovery typically?
So I mean, obviously barring any problem like bleeding or something else weird that's going on, you're talking about a week or 2 of needing to really put a lot of Vaseline or maybe for a couple of days, maybe some antibiotic ointment on the site to keep the skin from drying out, but also to keep it from getting stuck to the diaper. That's a biggie. So you're really greasing things up for probably a good 7 to 10 to 14 days.
No such thing as too much Vaseline.
There is no such thing. I mean, we used like a thing like, and I mean, I was very liberal with it. But yeah, you're talking about that for a couple of weeks, basically.
Okay. And then normal findings for you get your newborn circumcised and you're day 3 or 4 into it healing, like what is normal to see and what is like abnormal or reasons to call your doctor.
Yeah, so it looks kind of yucky, to be honest. I mean, there's like dead skin and gunk that's coming off. So there's some yellowish stuff, some whitish stuff. Things could slough. You may see a little scab-like material. You could see a tiny bit of blood. That's all normal, a little bit of swelling. Things you should not see, like active bleeding, like there should not be dripping or squirting blood. If there is, grab something, put pressure on it. It's lucky the penis is small. You can, even an adult, you can just, put pressure on it. Shouldn't see that. You shouldn't see spreading redness going like up to the body, down to the scrotum, onto the legs. Shouldn't see widespread discoloration. And if there's any high volume, most stuff that's coming off is just dead skin. It's usually not, people think it's pus, but it's usually not. But if you're,
that yellow color
there's that stuff, and that's still usually just dead skin. But if there's a high volume of yellowish stuff, more than just a tiny amount, then that's something you need to get looked at. Yep. And if you see anything else weird, like urine coming out of places, not the tip of the penis, anything strange like that, skin is missing, you need to go get looked at.
And then what would you say are, I have a few in mind so that I can throw out there, but what would you say are some of the more like common complications following a circumcision? Like one of the things that come to mind that I've seen is adhesions.
Sure.
And then seeing a urologist for that. And it typically is just like, again, using a ton of Vaseline and actually just drying back on the head of the penis. I feel like that's like, I've seen that. I've heard about that often. I've seen it often. Or is there anything else maybe explaining what an adhesion is?
Sure.
But then anything else that sort of like comes to mind that is a complication, sort of like a low risk one, but does come up.
Yeah. So I mean, like serious stuff, like they nailed deeper structures. That's a whole separate thing. And you would know immediately that happened like during the circumcision. So afterwards, most of the problems relate to the skin of the shaft of the penis in relation to the incision where the circumcision was or the head of the penis. So that's everything from like the Bill Belichick, with this, which we would call an incomplete circumcision, where it may need to be revised. So that means not enough skin was taken off. That usually has to do with someone who's inexperienced or nervous to remove too much skin.
So is that a scenario where like if the parents think that, so this is a question that comes up, like if parents think that not enough has been taken off, obviously seeing a specialist or a pediatric urologist sooner rather than later is better because they can take it off.
Well,
more of it off sooner, no?
Probably not. The short answer is when kids are young, you've got a couple issues. One is they can get sort of some poochiness around their genitals, kind of like a fupa kind of thing, that may obscure what's going on. And so you may not know till they get closer to a year or more to know exactly what it's going to look like. And to be honest, they tend to wait until kids are closer to 6 to 12 months to have anesthesia anyway. So if you're looking down the road, so there's no reason to run to see somebody. They're going to delay anything for a while to see what it shakes out as. Part of it also relates to kids' sort of weight changes in their skin, or as they start to get little baby erections, what's going on. So sometimes you just can't tell early on. But if there's a ton of excess skin that, and you don't like the appearance, that needs to be revised by a pediatric urologist. Lesser than that can be varying degrees of the skin gets stuck or grows funny or didn't heal right. So you can have like this to any part along the way. So, and basically what you're dealing with shaft skin that's getting stuck either to the head of the penis or to just below it or to the circumcision site itself. Sometimes the skin is flimsy and can be peeled off. Sometimes it needs to be, surgically opened up, but you can get varying degrees of that. Some of that is just from either not kind of keeping things clean and greased up, or sometimes it'll just undo itself as they age and they start to either get erections or you're more aggressive about cleaning them. So you can get the whole circumcision incision if you're not careful. The shaft skin could get stuck to the whole thing and heal that way. But you can often pry that apart carefully, like during bath time.
I feel like most, that's where the recommendation, in my experience, has been where the pediatric urologist will recommend like tons of Vaseline.
Vaseline, bath time, stretch it out. And often if you're dealing with just thin areas of skin, you can often use really potent steroids to dissolve that too, if that's a problem.
And then what about now moving into your specialty, going into the scenario where, you choose not to get your child circumcised. And now you have a child who's turned into an adult
Yep.
and decided they want to get circumcised.
Yep.
Walk me through how that, obviously we've touched on how this is different, but like what are we talking about here? It sounds like there's a lot more risk, a lot more pain.
Sure.
Recovery process is more challenging.
Yep.
What are you seeing?
So step one is get the kid's parents therapy because they didn't do it as a newborn. So I can't tell you how many fathers, especially of college age kids,
bad?
horrible.
Oh.
Yes. So, when you're talking about 50-year-olds, usually their parents aren't involved anymore, but
Yeah.
I can't tell you how many college kids I've circumcised and their fathers are just like beside themselves.
No.
Yeah, it happens. So, which is why I advise doing it. If you're thinking when they're newborns, it's just easier.
Right.
So adult or even teenage circumcision, or even, 6-year-old.
Right. Older kids. Yeah.
Older kids.
Yeah.
So, and through young adulthood or adult, whatever we call adulthood now, you're basically talking about general anesthesia, most likely. Because, stress, anxiety, you need them to hold still. It's a longer procedure, a whole bunch of other things. Yeah. And usually this isn't done with a clamp like a newborn. You're usually, drawing the incisions on the penis, using a scalpel, cutting it off, sewing it back together. So it takes longer. Yeah. Like a newborn circumcision is a couple of minutes.
Yeah.
This is like, an hour.
Yeah.
So a longer procedure.
Yep.
Usually this is a day surgery. So outpatient, come in, have, meet the anesthesiologist, surgery, go home. Yep. So a couple big things to know. Biggest risk is bleeding, far and away. Yep. People's penises look horrible after a adult circumcision. And I tell people literally, it's going to look like a dog chewed on it for 6 weeks. Looks horrible because it's swollen. Yeah. There's bruising all up and down the shaft, sometimes onto the scrotum, sometimes the lower abdominal wall. Usually people don't have like bleeding where you need to take them back to the OR or they need to come to the ER, but you can get, bleeding under the skin where it's coming out the suture line. You need to put pressure on it. We spend a lot of time in the OR preventing that, trying to get things sewn up and cauterized and whatever. But that's the single biggest risk, but they look bad and they're swollen and bruised for a long time. Yeah. And the final cosmetic results, sometimes you're talking 3 to 6 months for all the swelling to subside. Wow. Yeah. I hang a lot of crepe when I do this. I'm like, this isn't going to look right for 6 months. And then if it looks okay at 2 months, they're happy, but it can take a long time to get the final result. Infections are rare. These are usually healthy people with healthy skin. Even older folks who are diabetic, it usually heals fine, but can get all that like dead skin, looks yucky, something's coming off that looks yellow. Yeah. Is it infected? It's usually not infected, but there's skin issues after and people are nervous about it and whatnot. Another big thing can happen in this group is if they use a lot of antibiotic ointment, they can get an allergic reaction to it that can cause penile swelling. So we push a lot of Vaseline, especially. Yep. But there's going to be a delay to getting back to sexual activity that can be a couple of months sometimes. Right. Big issue, especially with teenagers and college age kids, is getting erections post-op. So sometimes we put people on antidepressants for a short period of time to knock their erections down. Yeah. Because that can hurt at night, stretch the stitches, stuff like that. Yeah. So other big things afterwards are sensory changes. So some men feel like super heightened sensation in the penis. It's been covered up and now it's like hitting their underwear, can't wear underwear, can't wear pants, can't walk. Yeah. And some people feel numbness. So it varies. Yep. Usually that'll straighten itself out within about 2, 3, 4 weeks.
And then what about pain?
People, it hurts, they're sore. Usually it's just Tylenol and Advil though for pain relief. Okay. We usually use long-acting local anesthetics that last 6 or 8 hours. And then usually Tylenol and Advil. Occasionally some people need some opiates, but usually that will do it. But most of the problems honestly are like, it's the sensation of their penis touching stuff is what bothers a lot of it. It's that or getting an erection is often what it is. It's the incision will hurt, but that goes away pretty quickly. It's that other sensory stuff that often bothers a lot of people. Gotcha. Other thing that can happen is you got to be really careful to take the right amount of skin off, not enough. Bill Belichick, too much, you can get what's called core D where your erections bend. Okay. So you got to be very careful to do that. And it's easier with an adult penis to measure that, to try to avoid those things.
Gotcha. Wrapping up here.
Yeah.
I feel like this is an obvious answer, but coming from your world, your medical background, if you're considering circumcision at all, your recommendation is doing it in the newborn phase.
Yes. I mean, if you're entertaining it, I say do it in the newborn phase. Yeah. If you are not entertaining it, I think that's fine. Yeah. I think all the major medical societies that deal with this stuff agree, American Urologist Association, American Academy of Pediatrics, American Academy of Family Practitioners, American College of Obstetricians, Gynecologists, CDC, they all say it's the benefits outweigh the risks. Yeah. They all have basically the same statement. Yeah. Benefits outweigh the risks. However, it's not so beneficial that every newborn boy should be circumcised.
Right.
So that's basically my feeling. If you're not inclined, I don't browbeat anybody into doing it.
No.
If you're inclined, I would do it as a newborn.
Yeah. And when
I think it's that
you're-
binary, to be honest.
Right. And when you're, and one of the things to consider when you're making the decision is what it could look like if your child's older and would get a circumcision then. I just think that's part of
that's how I look at
process.
it.
Yeah.
That's the entire way I look at it
Yeah.
is if you're uncircumcised, you will probably be fine. And most people are.
Right.
However, if you are not, it is ugly and it could have been dealt with. Yeah. And, one of the more interesting things I ever saw was Kaiser Permanente years ago. They looked at the cost of doing all the medically indicated adult circumcisions, and it cost their health system the same as doing all the newborns.
Really?
Yes. It didn't get a lot of play.
Right.
But this was about 15 years ago they published this, but the cost was the same.
That is
And
interesting.
yeah, and so I walked away from that and said, just do the newborns.
Right. Yeah. Well, thank you so much.
You're welcome.
I hope that you all found this insightful, especially for those of you having a boy or are having a surprise and are having this conversation internally at home.
Yeah.
If people have questions, where do you feel like is the best resource for people to get good information related to questions, decision-making process?
Yes. So of all the places I just mentioned, the American Academy of Pediatrics has probably the best. If you just look up AAP circumcision, it goes into it. Yeah. They don't have much in the way of diagrams, as I recall, but they've got a good narrative.
Okay.
And frankly, the CDC actually had a really good, if you do look up CDC circumcision, they go more into the sexual infection part of it and the urinary tract infection part of it, but very robust. And if you just look up newborn circumcision, you'll see, some cartoons of what it looks like out there. So.
All right, great. And we can put some of those, we had talked about resources prior to this and you sent me some. So we'll put some of those resources in the show notes as well.
All right.
All right. Awesome. Thank you, Peter.
You're welcome.
All right. Next up, vasectomies.
Yes.
Stay tuned.